Hello, good morning, good afternoon, good evening, wherever you are in the world. Welcome to our leadership discussion today. I'm Catherine Bertini. I'm a distinguished fellow at the Chicago Council on Global Affairs. And I think you know that the Chicago Council is an independent, nonpartisan platform, and that the views expressed by individuals here are their own and don't represent institutional views of the Council. I hope you check the Council for social media updates and other information that the Council is putting out, as well as a recording of this afterwards. I want to thank all of the members of the Council who have tuned in, not only for tuning in today, but all of your strong support to the Council in the past, and especially at this critical time. And a special welcome to everyone joining the Council for the first time. Our main topic today is about the leadership challenges facing people around the globe with COVID-19, both currently and in the future. And we're absolutely thrilled to have with us today Dr. David Nabarro to talk about these matters. Dr. Nabarro, David, was the special envoy for West Africa Ebola response for the UN. He was also the special coordinator for the UN for the avian flu, the bird flu epidemic, and he is currently special envoy for the World Health Organization for this COVID-19 response. He has a long history of work in infectious diseases and in public health. And David, welcome. We're really thrilled you could be with us today.
Thank you so much, Catherine. It's great to be with you all. I'm delighted to be part of this webinar.
Thank you. Let's start with giving us an update, please, David, before we get into leadership issues. Just give us an update of where we are in the world with COVID-19 and what you see for its future and our future in that context.
Thanks very much indeed. Well, everybody, we're all very aware of this virus, the COVID, and the terrible distress and destruction it's causing. But we sometimes forget that 4 months ago, the public health community around the world didn't know about it at all. And really, the first thing that was heard, there was a problem developing, was a message received at the end of December in the World Health Organization. And if we count between the end of December and now, it really is just 4 months. And in these 4 months, what an extraordinary transformation there's been. Let's start at the beginning. This virus causes a rather unpleasant infection that starts in the chest, and then, if we're unlucky, can affect the whole body. But as far as we can tell, out of every 100 people who are infected by the virus, only about 20 become really ill. And fortunately, only about 2% of those are likely to die. The trouble is that because this is a new virus, we've been having to learn about it all the time. And at the beginning, many thought it was a bit like influenza. Influenza, the disease caused again by a virus, but it's a virus that we know quite well. And we've had pandemics of influenza at intervals throughout the years. Some of them have been very serious, 1918, some less so in 2009. This is not an influenza pandemic. At the beginning, it was identified as an outbreak of atypical pneumonia, as we call it, respiratory disease. And it was quite rapidly discovered that it was caused by a coronavirus. There aren't many coronaviruses known to humanity, but they are also at the same time frequently encountered because the virus that causes the common cold, or one of them, is a coronavirus. There was another coronavirus that emerged in 2003 that caused an outbreak of a disease called severe acute respiratory syndrome in East Asia. And it was discovered as a coronavirus in China early in January. And the structure of the virus was quickly discovered and made available internationally. And the World Health Organization's initial reaction was the following. This is a potentially very serious disease. It has the ability to spread quickly, and it will cause a great deal of suffering, particularly among older people. When I say spread quickly, this virus spreads alarmingly rapidly. It causes outbreaks of disease that double in size every 2 to 2.5 days if it's left unchecked. So that means that it's very easy for an outbreak of the disease to build up fast. It's transmitted only really through respiratory droplets. These are the small droplets that come out of our mouths when we're talking, when we're sneezing, when we're coughing. And usually these droplets don't go further than just over 3 feet or 1 meter. And so if we can stay apart from each other 2 meters, then it's very hard for this virus to be transmitted from one person to another. Now, the way in which the transmission occurs is that basically people infect each other through this close contact. And if we want to stop an outbreak building up in any location, the easiest way to do it is to interrupt transmission by finding people with the disease and isolating them quickly, and finding those with whom they've been in contact recently and isolating them as well. And in that way, as soon as an outbreak starts, it's interrupted. Now, if we're unable to do that really quickly, then the outbreak can build up. It can increase 1,000 times in size in the space of a month. And so when we've got these big increases, then a different tactic has to be added. As well as encouraging the interruption of transmission wherever it's happening, we also introduce physical distancing on a large scale so that people have to keep more than 6 feet apart from each other. And the best way to do that, countries have discovered, is to do stay-at-home orders or shelter-in-place orders, or what in some countries is referred to as a lockdown. A lockdown itself doesn't stop transmission, but it slows the spread of the disease so that the painstaking work to find people with the disease and isolate them can go on so as to interrupt transmission and deflate the outbreaks so that we end up without the disease. Now, because the disease has been spreading so fast, and because many countries found it hard to initiate this interruption of transmission really quickly, more than half the world now is living under conditions of lockdown. And the big challenge for every government everywhere is how do we get out of lockdown and get our economies functioning again and getting society to return to a point where everybody is happy, even though the virus itself is not going to go away. And that's why more and more countries are looking to examples, particularly from East Asia, but also in Europe now, of countries that have worked out how best to cope with the fact that the virus is still here, is not going to go away for the foreseeable future. And yet at the same time, we can't go on living in lockdown because of its damage to people's lives, to people's livelihoods, to business, and indeed to everything involved in people moving around and getting on with their business. So, what is it that countries are doing to enable them to deal with this threat? Let's look at the example of South Korea. They had the experience of SARS in 2003. They knew that as soon as you get outbreaks of a virus like this, a coronavirus, remember, not a flu virus, as soon as you get outbreaks of this new coronavirus, the most important thing to do is to spot them fast, ideally to confirm that people have got the disease with virus testing, and then to do everything you can to interrupt transmission by isolating people when they've got the signs of the disease immediately and finding the people with whom they've been in contact and isolating them as well. And so South Korea was able to get a measure of control quite quickly, but not before they'd struggled with a big series of outbreaks in Daegu as a result of a number of gatherings that occurred. South Korea could do it. Obviously, other countries have done it. Singapore did it as well, but they have had a resurgence of outbreaks because of people coming back into the country. So they've had to institute some limited lockdowns, but they've really boosted their capacity for finding people with the disease and interrupting transmission. Another country that's doing quite successfully on this is Germany. They prioritized the business of finding people with the disease. They had the capacity to test quite widely, but their technique, which was important, was that they reinforced community health services with volunteers and then with new staff, thousands of them, so that they could fan out across the whole of the community and be ready to find people who were sick and make sure that they were isolated. The other thing that Germany and South Korea and Singapore have done is they recognized that older people were particularly at threat, and so they put special protection in place for older people as well. Now, Catherine, I know, wants me to talk about what life will be like in the coming weeks and months with this virus in our midst, with the threat of big outbreaks, with the possibility when outbreaks come, they will overload health services. What's happening around the world? Most important requirement, and I have to keep repeating it, is this capacity to find people with the disease, to isolate them, to trace their contacts, isolate them, to protect the elderly, and to make sure that hospitals are equipped so that they can respond if there's a big increase in the number of people with the disease. Super challenging, given that at the moment, the levels of protective equipment for health workers are in short supply, and also testing to find people whether they've got the virus is not easily done. And there are many parts of the world where testing is just not available. So what we're saying, all of us who are working for public health, is really focus on community public health capacity. Get that in place, make sure that it's strong, learn from what countries of East Asia have done, make sure all people know about the disease and what they've got to do, make sure you've got this found out public health capacity across the community, get your hospitals ready so that if there is a upsurge in cases, they can respond without being overloaded, make sure they can go and provide other forms of healthcare. And because you will from time to time get outbreaks, that's going to be the pattern of the future, then make sure that you can protect poor people who suffer as a result of lockdowns, ensure they can get cash and food, make sure that their children can continue to be educated so that you prevent the effects of containment measures from actually themselves causing a lot of distress. But you can't restart your economy unless you've got this basic health capacity in place. And that's what countries all over the world now are doing, particularly, I want to say, in the poorer countries who realize that they really can't afford to lock down for too long. So they're rushing to put public health services in place and trying to get that right because they're going to need that for the foreseeable future. I call it the COVID-ready state, and that's what we've all got to have for time to come.
Thanks, David. Well, let's talk about this issue of who decides what when, because this is a leadership issue. Well, in a non-pandemic environment, we count on public health professionals, the CDC in the US, the World Health Organization internationally, and every nation has some sort of an entity who gives advice about how to avoid disease, how to cope with disease, and who obviously follows whether or not there's anything traumatic that might come our way. But at some point, when it becomes more of a disaster, more of a problem, or more of a potential problem, the leadership shifts from the public health professionals to the elected officials or the politically chosen officials, whether that be on the national or the state or the community level. What indicators should we know about what happens for when that shift occurs? Because somehow it occurs when it moves from being just a health issue to being an issue that impacts all aspects of society.
Thank you, Catherine. You know that I worked quite a lot on other outbreaks and pandemics, and the main one at the beginning was on influenza. And the thing about influenza pandemics is there's always a point when you realize that the virus is just going to spread everywhere, and your strategy shifts from one of trying to contain the virus and stop its spread to one of trying to limit its consequences for people. And that shift is often quite clearly described as the shift from containment to mitigation. What the colleagues in the World Health Organization said, even in January as this was emerging, they said, be careful. This is not flu. This is a coronavirus, and it causes small outbreaks that grow big. They don't grow everywhere all over the country in the same way as influenza does. You don't end up with an awful lot of people infected and something called herd immunity building up. On this one, you have to keep the public health functions right at the center and have them strong and in place, even when you've got a most intense pandemic developing. That's one of the reasons why they delayed calling it a pandemic. They wanted to keep the focus on outbreaks and detecting outbreaks quickly. So in this particular situation, there's not been, in many of the countries in which I'm involved, a dramatic switch from the public health people being in a leadership position to heads of government taking it over. Instead, what's happening in every single country where I've been looking, the prime ministers or presidents with their cabinet are constantly seeking guidance from the public health community, asking the question, how can we emerge from our lockdowns whilst at the same time making sure that we're just not going to get flooded with lots of new cases of people with the COVID at the same time. So unlike anything I've ever seen before, the public health people and the heads of government are working hand in glove. It's not always an easy relationship because it's quite often presented by others who are in government as being a tussle between the economy and public health. But the public health people are having to keep saying the same point over and over again. It's going to be virtually impossible, they say, to restart the economy if the public health defences are not properly in place, if there isn't adequate testing to find people with the disease, and if the hospitals haven't been reinforced so that when new outbreaks come, they can be dealt with. That's because this is a completely novel virus and a novel form of pandemic, and it's due to this droplet transferred coronavirus, and that it's a threat that's going to be with us forever. So the public health people have to stay involved. However, there have been instances where heads of government have said to the public health people, hang on a bit, what you're asking us to do, to introduce these defences, to be ready to do lockdowns from time to time, these are all just too demanding on our economies. So they call in other people, the infectious disease modelers, who try to model the way in which the outbreak might go under different scenarios. Then they call in the people who are responsible for essential services and requirements, like the people in food and agriculture sector, or the people working in residential care, or the people from prisons who are very worried about how to manage their prisons. And what they're asking the public health people to do now is to help work out exactly how essential functions like food and food markets, essential functions like prisons and custodial services, or essential functions like residential care for people with special needs, how these can continue to occur, but with the added precautions in place for the public health imperatives to be held there. I have to stress that in every government with whom I'm working right now, this is a really difficult time because the public health people are giving the best advice they can based on what we know about this new virus, what we know about the immunity that develops when you've been infected, what they know about the prospects of a vaccine coming or the possibilities of different treatments. And they're trying to sift through all this information in real time. But at the same time, the heads of government are getting super frustrated. Their constituents are saying, we want to start again. We want to get working again. And we want to get onto airplanes again. And so there is a constant dialectic between the two. And I think both sides actually, Catherine, are finding it quite difficult because they see the trade-off very, very starkly, and they are very nervous about what might happen if they go either way. If they say, well, let's forget about the virus and just get on with life, that could lead to lots of deaths of older people, particularly in residential homes, or we're going to put maximum emphasis on trying to be super safe with regard to the virus, and then they worry that they're going to end up with an awful lot of people poor and not able to get employment. And that is what's happening right now. I don't think leadership has changed over, but I do think that there's a constant dialectic going on in every country to try to chart the best way through the lockdowns and into the new COVID-ready state that lies ahead.
Thanks, David. You wrote a paper for Harvard's Kennedy School last year, I think, where you talked with a couple of other authors about collaborative leadership. We see in the U.S. leadership at all different levels, and we hope that between the levels of community, county, state, federal governments, that there is a lot of collaborative leadership. It seems sometimes there is and sometimes there isn't, but this crisis, I think, shows that in every nation, collaborative leadership becomes very important. But how do you collaborate and lead at the same time?
Oh, yes. Well, first of all, I'd just like to acknowledge the work of Lisa Dreyer and Jane Nelson, who together with me wrote a paper on systems leadership. And we were actually focusing on the kind of leadership needed for any major challenge that requires people to work together and find optimal solutions that are greater than the sum of their individual contributions. And that's the kind of leadership that is absolutely essential now, and that actually I see being practiced in more and more locations as we come to understand exactly how dangerous this virus can be, especially if we don't work well together. Let me use 3 words. The first word is consistent. In countries that have very varied governance at different levels, sometimes even with different political parties dominating governance, say at the provincial level or at the local level, compared with the national level, there are real challenges with maintaining consistency of guidance and its implementation in a way that everybody knows what they're supposed to be doing. Many of us have seen how governance on multiple issues has been decentralized from the central government to the provincial administrations or state administrations, and from them to the county administrations or the commune administrations. And we have really now got extremely well documented cases and examples of how inconsistent leadership between different levels of government in a country can be a major problem in having a concerted and principled approach to dealing with this virus. Now, that can sometimes be, as I said, enhanced if there is political disagreement at different levels, and if there is a political party in charge of a provincial administration that's different from the political party in charge of the central administration. So we've also said, and this has been reinforced by the United Nations Secretary General, of course, as well as led by the World Health Organization Director General, that actually in dealing with COVID, we need to do everything we possibly can to avoid decisions being politically contested. They need to be consensus decisions if at all possible. And talking with leaders of some countries now, they've been explaining how they've been able to bring different political parties together for the duration of what they're seeing as the pandemic emergency in order to get consistency within countries. My second C relates to collaborative leadership, and that is the bringing together of different actors who are from all the different parts of the public health community so that they're able to work together. They need to have a common identity, that they're working for public health, they're working for the good of all people without any regard to sex or race or wealth or geographical origin, that they're just basically putting people's well-being at the center of their activity. Secondly, they need to be able to relate to each other in an environment where they respect and trust each other. And there's an enormous network of public health actors throughout the world now who are coming together regularly with deepest respect for each other as each trying to deal with the difficult issues. Thirdly, they need to be able to share information confidentially, not being scared that it's going to be used against them, so that they can express their anxieties and concerns as well as their ambitions. And this kind of networking of collaborative leadership is now very, very pronounced. It's built up strongly in the last 4 months, and it is keeping the public health community together and linking them with others responsible for key essential services. The third and last part, C, is coordination. You know, if one country is approaching their COVID using one series of techniques, and the next door country with which there's a long land border is approaching things differently, and if there's a lot of things being held up at the borders because of mistrust between the two countries, so that essential medicines or food or other requirements can't go across the border, then it's a really unsatisfactory situation. We have a challenge right now that's affecting 7.8 billion people. So the need for coordinated leadership is greater now more than any other time that I've been involved in global issues, and that's 45 years. And so many of us are kind of looking to the political leaders and saying, really, it is time for coordination. And it's time for coordination, particularly for the sake of poorer countries and poorer people who are much less easily able to deal with these issues. So the consistency, the degree of collectiveness and coordination are hallmarks of the leadership needed now to help us through the current crisis and into the new COVID-ready state.
Thank you. You mentioned many times WHO, and of course that's part of your role here today as a special envoy for WHO, but we really must talk about some of the strengths and weaknesses of WHO as an organization. Of course, The Guardian had an article recently which explained in its view some of those strengths and weaknesses. We've heard from the President of the United States about concerns about WHO. Tell us, please, how you see WHO's role in this crisis. You referred to their following this in December. Some have said that they didn't act soon enough to advise, but also about what their role is and what their role isn't, because people don't, I think, understand the extent of what is possible for the World Health Organization to do.
Thanks a lot. The first thing I want to say is just what it is like to be working in the midst of an outbreak, because I've done that now a few times. The most important thing to say is that when you are watching an outbreak build up, at the very beginning, you are never quite sure, is this going to be a really serious and major outbreak that's going to cause a huge amount of misery? And that's, of course, the exception. Or is this like what we normally see, a small outbreak that limits itself and that goes away? And, you know, there are hundreds and hundreds of outbreak alerts received by public health actors throughout the world all the time. And the real challenge is to sift through what are the ones that are potentially very serious, what are the ones that need to be taken up to become, to be judged as to whether or not they are of international concern. And making that judgment is the kind of thing that the technical teams in the World Health Organization, staffed by specialists from all over the world, with huge networks that go into all the public health institutions, again throughout the world, and of course involving the United States as a very, very important contributor. And using that network and using all the intelligence that WHO picks up, always trying to make a judgment, what is it we're seeing here and what's its implications likely to be? But afterwards, you can always find places where different decisions should have been made. We know that. And those of us who work in public health basically thrive on what we call after-action reviews, because through that, we modify and change. For example, after the Ebola outbreak in West Africa, Catherine, there were many studies that identified points where action could have been taken more rapidly, could have been done differently, people could have been more forthright, supplies could have gotten to place quicker. all things that would have led to a much lower death rate and much better consequences. And so after action reviews are key. When you're in the middle of it and trying to make decisions day by day, you do sometimes have to make very tough calls. And so the after action review helps us to be better. So that's number one. And I and everybody else who's been involved in this, we're looking forward to the after action reviews. We hope that they're undertaken perhaps after we've got through the current really intense emergency, because quite honestly, being asked to find every single email, text message, notebook record, and all the other things that are necessary for these kinds of inquiries, right when you are just super busy dealing with massive problems, particularly in developing countries right now, that is a bit difficult. Now about the World Health Organization. This is part of the what we call multilateral system. It's one of about, I think, 22 specialized agencies. They're not directly reporting to the Secretary General of the UN. They have their own independent governance. In the case of WHO, that governance is made up of 194 different member states. Those member states meet every year in the World Health Assembly, and then twice a year in smaller executive boards that meet in January and also towards the middle of the year. In these meetings, the member states, as they're called, with their delegations, hammer out the rules under which the WHO is going to work. The Secretariat of WHO, made up of the Director General, who's the Chief Officer, a team, it's not very large, of technical experts who are monitoring disease and dealing with health emergencies, and then teams in 6 other locations around the world in WHO's regional offices and more than 130 country offices. They all report into this headquarters. It's an organization with an overall budget of just over 2 billion. It's supplemented by various other funds, but that core budget is about 1/3 of the budget of the US Centers for Disease Control. Yet this is the equivalent of the Centers for Disease Control of the world. And as I say, they operate within the rules set by the member states. After the SARS outbreak in 2003, the basic rule for how the WHO deals with infectious disease was subject to revision. It took 2 years, and what came out was something called the International Health Regulations of 2005. These indicate the responsibilities of governments when they've got infectious diseases and how they should inform WHO, what they should tell WHO, and what they should allow WHO to do. Also, it indicates that if they impose travel restrictions, they should inform the WHO. That's basically to make sure that any information that comes to the WHO Secretariat is then broadcast to everybody else simultaneously with no hiding. And so when you're sitting in the WHO headquarters and you get news of something going on sent to you by a member state, you rely on the information provided by that member state. WHO is not an international health inspectorate. It's never been given the license to do that. The international health regulations are very clear. They say that the Secretariat works on the basis of official information given to it by the member states. The member states have also agreed that WHO can scan publicly accessible areas to get rumors and information, and also WHO can receive emails in from people around the world providing it with information. But basically, that's the way it is. WHO works on what it is given. WHO's technical experts then weigh up the information and provide feedback to the public everywhere. Have we got here an infectious disease? Is it an infectious disease where there is localized transmission? Is it an infectious disease where there's transmission in the community? Is it an infectious disease that threatens wider public health? And so during January, as the information about this disease reached WHO, and of course everybody was involved, then the World Health Organization had to reach, its technical staff had to reach judgments on what was happening, and that's all being recorded and it's being spoken about. And I'm not going to go into the details of what bits of judgment were reached at what time, But the important thing is that around, I think it is the 22nd of January, the Director General said, I'm going to bring together the Emergency Committee, which is a committee made up of specialists from around the world, and I'm going to ask them to advise me, is this a public health emergency of international concern? That's the highest alert that the WHO can give. Calling a pandemic is not actually something that's official in the rule book, but the rules say a PHEIC, which is the International Concern Declaration, is the major serious emergency declaration. That committee, when it meant it was on the 23rd of January, could not reach a unanimous conclusion. And they said to the Director General, we're going to reconvene again in 10 days' time, because at that time, there was very, very little transmission of the disease outside of the Chinese mainland. So the Director General actually asked them to reconvene more quickly, and they reconvened again. I think it was just towards the 30th of January. And then there was the unanimous opinion of the committee that this was serious. And the Director General said, thank goodness I come back, because I think we need to declare this as a public health emergency of international concern. And it was declared. And that was when WHO gave very, very strong advice to all governments. There is only one way to behave with this virus: treat it with enormous respect and close down outbreaks as soon as you get evidence that they're starting. Do not delay. The problems will be very severe. And that guidance has remained consistent ever since. Now, there have been, of course, some questions. Sorry, Catherine, I realise I might be overdoing it. Some questions about, was this done quickly enough or not? Please let that be discussed during the after action.
Yes.
Really important thing to say is that the WHO, that is created by its governors, operates within the rule book that has been given to it. And of course, if the rule book needs to be changed, and I'm sure it will be changed, then the technical experts in the WHO will work in a different way. But right now, it's working within rules that have been set by the world's governments in 2005.
Thanks, David. And I know we've had several questions about WHO, so I hope that your answer or your discussion just now answered some of those questions. But there's a few follow-ups. Yes, WHO is clearly will get into the lessons learned business, as will much of the rest of the world, I'm sure, afterwards, and evaluating how not only they responded, but the UN and responded, and governments in at every level in every country. But right now, there's some other questions about follow-up and about supports. For instance, there was a big event 2 nights ago, totally virtual, but to raise money for related causes and for COVID-19. And we also saw that the UN just appealed today, I think, for another $2 billion, including $350 million for logistics and transportation. So, and then we know that the U.S. is going to withhold some of its own funding. So, could you just spend a very short answer on, because we are going to be soon running out of time, about the needs of financial needs?
Just the costs of this outbreak to people and to national economies, indeed to the world, are just so huge that I can't put a number on it right now. But the urgent needs are also huge for getting protective equipment to health workers, for ensuring collaborative research on finding better tests, and also discovering a vaccine as quickly as possible. And so requests for money that are coming through are really about getting essential goods and support to people in poorer countries, people whose health services are run on perhaps 1,000 times less per person than the health services in the US or Europe. And any of these appeals, and they've got obviously big figures on them, they sound big, they're actually going to contribute a small fraction of the total amount of money that is needed by poor communities in poor countries. And that's why there is all this emphasis on money raising right now. It's the poorer people, poorer countries who are most at risk and most in need. Cutting money from WHO is a bit like trying to remove the right hand of a surgeon when she's in the middle of a delicate operation. I won't say any more about that.
Thanks, David. A mentor of mine, Marianne Fish, once said, on leadership, you see what someone's really like when they're in the midst of a crisis. Given that, as perhaps a closing comment, what advice would you give to leaders at every level? If you were to give one piece of advice about what they should be paying attention to or doing, what would that be?
Focus on the people, all the people, not just to those who are here now, but the generations to come. Make sure that they have as much opportunity as they should do to be healthy, to be safe, to be informed, and to themselves lead, because the actions we take now will have impacts for a very long time. The decisions we make now will be judged over time. Did we prioritize the needs of all people? Were we fair? Were we just? Do we respect human rights? Or have we somehow not found it possible in our decision making to put the needs of people right at the front of every choice we make?
Thank you. And finally, about the future, the role of young people. Young people are sitting home, maybe not understanding this crisis better than older generations are, but it will be their future. And what advice would you give to young people around the world about how they might lead in the future and learn from the lessons of this crisis?
Very much. This virus has managed to find its way through the various defenses we have in our society that keep us all healthy in the face of threats to our health. We had another virus that did this 25 years ago, the virus that causes HIV/AIDS. And the way in which societies learned to live with this virus as a threat was by changing behavior in order to outwit the virus, and by doing it in a way that still enabled us to love and to have joy, despite the threats that it posed. And the people who led that work actually were not people like myself, doctors or other health professionals. It was the people, everybody, particularly young people. They just said, okay, we'll get on with it. We'll find ways. We'll find ways to live and love with HIV. Well, this virus is a bit trickier than HIV because it is transmitted so easily through close contact between someone who has the disease and someone who does not. But I would like to encourage everybody, young or old, whoever they are, wherever they are, to be thinking really hard right now. How could we go on with a life that's full, that's fair, and that's really going to give us the best possible chance for the future, whilst at the same time keeping ourselves, our communities, our older people, our people with special needs safe from having their own existences put into question as a result of this virus? It's going to require ingenuity from all of us, knowing how to behave when we have symptoms of the disease, whether we're at school or at university or at work or in the gym or in the club. Knowing how we're going to be able to get in touch with those with whom we've been in contact if it turns out we've got the disease. Will we be using apps? Will we be using WhatsApp groups? Will we be simply just putting a message on our Facebook site saying, this is what's happened to me? How are we going to think about health in the future? You know, investment in health in many countries has been dropping compared with investment in so many other areas. Yet businesses aren't going to be able to function to the full now without strong health services. And nobody's going to be able to go to a hospital and expect to get decent health care unless they can be confident that their health workers are being properly protected. There are so many hospitals now where health workers are having to struggle to protect themselves. And this in turn is putting their own health at risk and the health of other patients at risk. So we need to be thinking very hard. What is the place of health workers in our society? Not just the people who are the doctors and nurses, but the people who actually keep our hospitals running. And then what about residential care? Typically, homes for older people are staffed by people who are on very, very low wages and very informal contracts. How are we going to find ways to respect the people on whom we're going to defend in the future to keep us healthy? If you're young and if you've got time and if you're not too hemmed in by any of the assumptions that come, people like me as we get older, I'm very rigid in my thinking, but please let your mind flow, mingle up together your sense of humanity and the common good and love and joy and the wish to live and the wish to look after others, and think of yourselves as how can we work together to be part of the web of the COVID-ready society that's going to be the society from now for the foreseeable future. Because I can't put my hand on my heart. And so we'll have a vaccine that will keep everybody immune in 1 year, 2 years, 3 years. There's so many things we don't know about this virus, including how easy it's going to be to develop a vaccine. So it's over to you, to all of you, to use your ingenuity, your connections, your opportunity to dialogue and debate. Think hard how to have a COVID-ready society where nobody is stigmatized, no nation is left behind, no community is under great stress, even if they are refugees stuck in a refugee shelter, or people in a prison, or old people in a residential care home, or the staff looking after them. How can we work together to get this right? I think it's the biggest challenge that humanity has faced, in my knowledge, probably since it was discovered by John Snow in 1854 that dirty water carried cholera, and our whole behavior towards feces and sanitation had to shift. Now we've got to do another massive shift, and we've got to do it really fast.
Thank you, David. Thank you for being so informative. Thank you for your leadership. And thank all of our audience who joined us today.
Can I
Signing off.
Big shout out, Catherine, before she goes. Catherine Bertini, you led in the United Nations, you revolutionized the World Food Programme, you've done masses of other brilliant things on leadership, and you are so modest, and you've just given it all to me. I want to give it back to you. It's been an honor to have this discussion with you and to be working with you over the years. And I'm just so grateful to the Chicago Council for enabling us to have this exchange. Wonderful. Thank you.
Thank you, David. Thank you, Chicago Council on Global Affairs, and thank you to all who participated.